Why is caries management so important? Let's go to photo number 1. And in photo number 1, what you're seeing, I've just recently removed an MOD composite due to a secondary caries present on the distal part of the box. What you're seeing right here is that contaminated, infected dentin, that leathery brownish color that you see. But how do you really identify the infected and the affected dentin from the healthy and clean dentin? Well, that's why we use caries detection dye. So we apply caries detection dye, which is a red dye, to all the tooth. We leave it there for 5 seconds. We rinse it off, and you can see that I only now have a stain on the distal part. That's where the caries, that infected and affected dentin has been concentrated. So if you go to photo number 3, in photo number 3, I'm going to start cleaning this dye by removing the infected dentin with a diamond burr. I'm using a small round, maybe number 2 diamond burr, and I'm going to start on that peripheral seal zone, on that area that's 2 millimeters within that DEJ. If you go to photo number 4, you can see that now that DEJ, that 2 millimeters within the DEJ, is nice and clean. There's still some pink color left on the axial wall, and the reason for that is because this is a young patient. I'm very close to the pulp. This tooth was responding well to cold testing, so I know it's vital, but I don't want to continue removing more of that affected dentin on that axial wall because I will expose the pulp for sure. So what do I do next? Well, I can start restoring, because we also know that this caries detection dye does not affect at all your bond strength. So I place my band, and if you go to photo number 6, you can see that I've now built my distal proximal wall. On photo number 7, I built my mesial proximal wall, and on photo number 8, I've completed my restoration. So why is caries management so important? Because if you want to get good bond strength in that critical aspect of your cavity, which is that box, mainly here on that distal box, you have to have clean peripheral seal zone. No pink, no red stains in those areas. You saw that the mesial aspect was clean, so we went ahead and cleaned also the distal aspect, and now we can guarantee that this restoration is going to be strongly bonded and is going to be able to last and perform very, very well. See you on the next video.